Good morning. This lecture video is going to go over quickly the homeostatic regulation of the vascular system. So what are some things that are going to control our blood pressure, our vasoconstriction, venoconstriction, those types of things. So there's going to be two different ways in which the vascular information is going to be controlled. One is going to be by the nervous system, and one will be by the endocrine system. So the nervous system regulation is going to involve groups of neurons that are found in the medulla, and their job is to kind of respond to changes in blood pressure, also changes in oxygen and carbon dioxide concentration, and also the concentration of hydrogen ions. These are going to include three main centers, so the cardiovascular centers, the baroreceptors, and then the chemoreceptor reflexes. So starting with the cardiovascular centers, there are three paired components. There's the cardioaccelerator centers, and these are going to stimulate cardiac function via the sympathetic nervous system. There's the cardioinhibitor centers, and these are going to decrease heart rate and stroke volume via the parasympathetic system, specifically through the vagus nerve. And then the vasomotor centers, which are going to control contraction of vessels, affecting resistance, pressure, and flow, and cardiac output via norepinephrine of the sympathetic nervous system. The baroreceptors reflexes are specialized stretch receptors that are located within areas of our blood vessels and different chambers of our heart. Their job is to respond to changes due to the presence of blood. So they're basically sensing, if there's more blood, there's more pressure. So they're sensing, in a back way, the amount of pressure. And then they send impulses to the cardiovascular centers we just talked about to regulate blood pressure. If the blood pressure increases, baroreceptors will fire at a higher rate, and then they'll trigger the parasympathetic nervous system to basically reduce cardiac output, to cause vasodilation so that the arteries get bigger, and this will then bring the blood pressure back down. If the baroreceptors sense a decrease in blood pressure, then they're going to start to fire at a much slower rate, and that's going to trigger the sympathetic nervous system to get into action. It's going to increase the cardiac output, it's going to cause vasoconstriction to occur, and all of those things would then raise the blood pressure back up to where it should be. Now, the atrial reflex is a reflex system where baroreceptors in the vena cava and the right atrium are going to monitor the blood pressure as blood returns to the heart from systemic circulation. And so normally the blood flows into the aorta at the same as blood flowing back into the right atrium. So if blood is returning to the right atrium more rapidly than it is being ejected from the left ventricle, the atrial receptors will stimulate the cardiovascular centers to increase or to stimulate the sympathetic nervous system, increase cardio output, and again, blood pressure will then start to rise. And so this mechanism, this special mechanism, kind of monitoring the rate at which blood is coming in and then exiting, is called the atrial reflex. Chemoreceptors are going to be chemical receptors. They're going to monitor the levels of oxygen, carbon dioxide, and hydrogen ions that are in the blood. In order to adjust blood pressure, they are located very close to the baroreceptors in the aortic and the carotid sinuses. In a very active body, so in an active situation where you're needing more energy and you're, like for instance, in a moment of exercise, your oxygen levels are going to fall, right? Because your cells are using more oxygen at a faster rate. Your carbon dioxide levels are going to rise because you're spitting out more carbon dioxide, creating more waste products as your cells metabolize. The hydrogen ion levels will also rise, causing a drop in pH. And these things are going to stimulate then the cardioaccelerator and the vasomotor centers to then increase your cardiac output, to cause vasoconstriction of the arteries. And then the cardioinhibitor centers are also slowed to keep your blood pressure at the level that it should be. Also, so those are the nervous system regulations. The blood pressure is also going to be controlled by endocrine regulation, and not just blood pressure, but all in your arteries and your veins. And your endocrine system is going to rely on 5 different chemicals. So we have epinephrine and norepinephrine. These are going to be released by the adrenal medulla, and they're going to enhance and extend the body's sympathetic or the fight and flight response. So these are going to increase heart rate and force of contraction and the force of contraction while temporarily constricting your blood vessels to organs that are not essential and redirecting flow to the liver, the muscles, and the heart. So it's going to affect circulation because it's going to push blood to the areas that need it in a case of an emergency. Antidiuretic hormone, also known as ADH, and also called vasopressin. These are secreted by the cells in the hypothalamus and then transported via the hypothalamic hypophyseal tract to the posterior pituitary, where it is stored until released upon nervous stimulation. The trigger that promotes this to be released is increasing osmolarity of tissue fluid, usually in response to a significant loss of volume. So ADH signals its target cells in the kidneys to basically start reabsorbing more water, thus preventing the loss of additional fluid in the urine. This will increase overall fluid levels and then help restore blood volume and pressure. The renin-angiotensin-aldosterone mechanism is something we're going to look at more when we get to the renal unit, but this is also going to be a hormone pathway which is going to involve specialized cells in the kidney that respond to decreased blood flow. And when they respond to the decreased blood flow, they secrete a chemical called renin into the blood. Renin converts the plasma protein angiotensinogen, which is produced by the liver, into its active form, which is angiotensin 1. And then angiotensin 1 circulates in the blood and then is converted to angiotensin 2 in the lungs. These are also going to ultimately increase blood volume and increase blood pressure. It also actually, on a side note, stimulates the thirst center, so individuals will more likely consume more fluids, again in an attempt to increase blood volume and blood pressure. And we'll talk a lot more about this mechanism when we get to the kidney unit. Erythropoietin is released by the kidneys when blood flow and or oxygen levels decrease. EPO, you may have heard of it, we hear a lot about it during the Olympic time, stimulates the production of red blood cells within the bone marrow. Erythrocytes are the major formed elements of the blood, and contribute about 40% of our blood volume. So erythropoietin is going to play with the viscosity of the blood. That's how it's going to change resistance and pressure by making the blood thicker, typically, if it's been activated. And then last is the atrial natriuretic hormone. It's secreted by the cells in the atria of the heart. ANH is secreted when blood volume is high enough to cause the extreme stretching of the cardiac cells, and then the cells are going to the activation of the cells will promote the loss of sodium and water from the kidneys. They will then suppress this renin-angiotensin-aldosterone mechanism, and ultimately it's going to promote the loss of fluid from the body, so blood volume will end up decreasing and blood pressure then will also decrease. So those are kind of the hormone regulations that are involved. As the name would suggest for autoregulation of perfusion, there are mechanisms that require neither the nervous system or the endocrine system in order to regulate blood flow and adjust tissues, specific regions of tissues to blood flow. So these mechanisms don't require nervous or endocrine signals. They are going to allow regions of tissue to adjust its blood flow as needed in that specific region. There are chemical signals. So these are going to work at the level of the precapillary sphincters, and they're going to help trigger either constriction or relaxation. So remember, these are going to be those sphincters that are going to allow the capillaries to receive the blood. So with the sphincters open in response to decreased oxygen, increased carbon dioxide, and increase in lactic acid or hydrogen ions, thus causing an increase in perfusion. The myogenic response is a reaction to the stretching of the smooth muscles in the walls of the arteriole, again due to changes in flow. So if the flow is too high, the vessels will contract, and in response to the increased stretch, and if it's too low, then it'll dilate. So vasoconstriction will occur if the flow is too high, and then the flow will be slowed down in order to meet the needs of that particular tissue. So by monitoring flow, the smooth muscle can then adjust the diameter of those arterioles to make sure that the tissues in that area are getting properly perfused. Some different disruptions that occur from circulation is going to be hypertension, hypotension. So, well, first of all, exercise. So exercise is going to disrupt the blood flow, and it's a temporary and a very normal way. Typically, when you are going to be increasing cardiac output when you are exercising, and thus that's going to affect then the blood pressure. It's also going to change the chemical makeup of blood, which would then go back and stimulate those chemoreceptors to respond. Hypertension, hypotension refers to high blood pressure and low blood pressure. These are going to, hypertension can lead to, if the blood pressure gets too high, it can damage the arterial walls. So this can lead to aneurysms that occur if we're talking about this over a long period of time. Hypotension, we talked about, can lead to not having enough oxygen being delivered to the tissues and thus them not getting that nutrient that they need. Hemorrhage is going to be a major blood loss. However, so obviously when you lose a lot of blood, you're losing a lot of blood volume, and thus you're decreasing the amount of flow and you're decreasing the amount of cardiac output. So hemorrhaging is going to be very disruptive to the circulatory system, and it's going to need to be adjusted to from either the nervous and the endocrine system. And then circulatory shock is going to be caused by too much blood loss. So, and this is a life-threatening condition, basically where the circulatory system is unable to maintain blood flow to adequately supply sufficient oxygen and then other nutrients to maintain cellular metabolism. Typically, a patient in circulatory shock will demonstrate a high heart rate, but a decreased blood pressure. Typically, a patient will have a reduced urine output, and the patient will appear confused or lose consciousness. Unfortunately, unlike most of the other systems in the body, circulatory shock ends up working as a positive feedback mechanism. So once it starts, it just will accelerate itself quickly if things aren't intervened, if medical attention isn't intervened. Hypovolemic shock is caused by hemorrhaging in adults. This can be caused by severe vomiting or diarrhea, also by burns or exposures to some kind of toxins, excessive urine loss due to diabetes insipidus, or ketoacidosis. Typically, patients present with a rapid, almost tachycardia heart rate, a weak pulse, clammy skin, and because of the restricted blood flow, they have very rapid, shallow breathing. Treatment involves intravenous fluids to restore the patient to normal function and various drugs, such as dopamine, epinephrine, and norepinephrine to raise the blood pressure back up. Cardiogenic shock results from the inability of the heart to maintain the cardiac output. Most often it results from a heart attack, but it can also be caused by arrhythmias, valve disorders, cardiac failure, insufficient flow of blood through the cardiac vessels. And when a patient is experiencing cardiogenic shock, they will be treated with repairing the damage to the heart or its vessel in order to resolve the underlying cause. Vascular shock occurs when arterioles lose their normal muscular tone and dilate dramatically, so getting really big. It may arise from a variety of causes, and treatment almost always involves fluid replacement and medication, which will restore the tone of the muscles in the vessel. Obstructive shock, as the name would suggest, occurs when a significant portion of the vascular system is blocked. Treatment depends on the underlying cause, in addition to administering IV fluids, often administering an anticoagulant. So if there's a clot that exists that's causing blockage, the most common cause is a pulmonary embolism, which is a clot that lodges in the pulmonary vessel and then interrupts blood flow. But it can also be caused by a narrowing of the aortic valve or the aortic artery, and it's going to cause disruption because obviously blood isn't flowing the way where it needs to.